This country has done a great job on the corona, and I will say, the people that have worked on it have been amazing what we've done.
That was President Donald Trump bragging about how great of a job that he has done on the corona, despite all, of course, evidence to the contrary. Yeah. Okay, so now that's part of a rambling series of BS statements made during an interview with, as you can see, Fox and Friends, after the disaster that was the Axios interview with Jonathan Swan. The difference between these interviews, of course, is that Donald Trump got a lot more pushback on his bullcrap claims. Claims, of course, like this.
From ventilators where we had nothing to making them now for the world. You know, we're supplying the world now with ventilators. And you go back 4 months, we didn't have any. And it's a complicated piece of machinery. It's big. It's expensive. The job we've done has been an amazing job. My view is the schools should open. This thing's going away. It will go away like things go away. And my view is that schools should be open. If you look at children are almost, and I would almost say definitely, but almost immune from this disease. I mean, literally, they are virtually immune from this problem.
Okay. That's a lot of stupid condensed into a very small amount of space. It's like the black hole of stupid. It just kind of, it's very, very dense. Or even like a neutron star. Okay, anyway, enough of that. So let's break it down. Let's talk about ventilators, right? So now, look, it's actually true that Donald Trump has been doing great on ventilators, right? He's the king of ventilators. Okay, so now there's a problem with that. I'll get to that. So no, this is according to a report in ProPublica. The Trump administration has been sending a lot of ventilators around the world. From their report, White House officials have pushed the U.S. Agency for International Development to purchase thousands of expensive ventilator devices from U.S. companies and to donate them abroad. According to internal documents, emails seen by or described to ProPublica, and interviews with officials. So you get the White House saying, let's crank out these ventilators and let's send them abroad. Let's do it. One USAID official recently referred to the project in an internal email as the POTUS donation of ventilators, using an acronym, of course, for President of the United States, POTUS, all that, right? So now you're thinking, wait a minute, how's that a bad thing? We're giving ventilators, right? We're building the ventilators, so that means we're like keeping jobs and we're donating them. How can that possibly be a bad thing? Well, here we go. The effort, according to the report, has been marked by dysfunction, shocker, with little clarity on how countries are chosen or how ventilators are allocated. A USAID memo seen by ProPublica shows equipment donated to wealthy nations that typically do not get foreign aid, such as fellow NATO countries, and a few locations ill-equipped to use the devices that require round-the-clock staffing and regular maintenance. Oh, right. That. Got it. It gets worse, as it always does. The administration's decisions on ventilator distribution appear to have little correlation to the number of coronavirus deaths or infections in a country. Honduras, for example, which is receiving a total of 100 ventilators, had about 72 confirmed cases per 100,000 on June 11th, the day the plan was approved by a senior State Department official, according to WHO data. Neighboring El Salvador, which is set to receive 600 ventilators, had about 51 cases per 100,000 people at that point. Vietnam, also set to receive 100 ventilators, though the country has just a few hundred cases in all and no deaths. Okay, so wait. Countries with more cases somehow get less ventilators, and yet countries with, less cases get more ventilators. Does that make any sense to you guys? It's almost as if they're just handing out arbitrary numbers of ventilators to other countries in order to say, hey, look at how great we are at giving people ventilators. They wouldn't do that, right? Now, public health experts say, and this again is one of the other problems, that without carefully assessing each country's healthcare expertise and then following through to ensure hospitals can keep the machines running, the donations could go to waste or even risk patients' lives. Because, of course, most countries actually, in reality, do not need ventilators as much as they need to fund nurses, PPE, and simple oxygen supplies. So, I mean, not to say that they don't need ventilators or that no one needs ventilators, right? It's just they're for the most extreme cases. And you would actually need to do some real research and targeting and to figure out just how much people need, how many ventilators people need or what they need, and then target the aid accordingly. It seems like this is the equivalent of riding around in a limousine and throwing dollar bills out the back. Oh, right. That's Donald Trump. Awesome. Okay. So now, that's just one bullshit claim. Now we go to Trump's claim about children, which is even worse. You heard how he said that they're virtually immune to the virus. While it is true that children are less susceptible than adults to the virus, they can still get it and they can still transmit it to others in their household or within their own communities. Researchers in South Korea, for example, have found that children between the ages of 10 and 19 can transmit COVID-19 within a household just as much as adults, according to research published in the U.S. CDC and Prevention Journal, Emerging Infectious Diseases. So they also found that children, lower than 9 years old, still can transmit the virus fairly effectively, just a little bit less than those between 10 to 19. So that's the problem, by the way, with sending them back to school. They are a vector of disease. Only somebody with a very surface level of thinking, a smooth-brained Trump supporter, that can agree that it's a great idea to send kids back to school because, they get sick less than adults with coronavirus. But yes, they can still get the virus and still spread it around just as much as adults, even if they suffer from less symptoms. And it kills less children, right? It's really dumb. It's not smart. So now look, I want to get kids back into school, definitely, right? And look, if we had a less of an infection rate, right? If we had limited cases, we could consider that, right? But right now, we have no control of the virus. It's running wild. It's not just gonna go away like things go away, as Trump claims, right? And he's been claiming that since the beginning. He's still wrong. He was always wrong, and he's getting called out for it, of course. First again by the media, and now by social media. For example, one person saying, Donald Trump is still saying that COVID will go away. He's also saying kids are virtually immune to the problem. I have 2 grandchildren, and both of them got it. And it wasn't just sniffles. Guess they missed out on the virtual immunity. Another person says, so false. They've got the worst response in the developed world, responding to Trump's doing a great job on the corona, right? 156,000 dead, nearing 5 million cases, which is a huge undercount, they say, as cases are 1/10 to 1/3 of the U.S. population, and an ignorant president. Another person says, ABC just interviewed a child who lost both of his parents to COVID-19. If schools reopen while COVID is still on a tear, we're going to hear more stories like that, only they'll be more tragic because the orphans will know that they are the ones who brought the virus home to their parents and, of course, grandparents and family members. It's just disastrous. And then one more here. This person says, the only thing that will go away will be the lives and futures of a lot of kids who will get sick and possibly die, because children will die. It may be a smaller amount, but the children will die. It will die. They will die. And not to mention their parents and close relatives. It's so crazy it defies my ability to process. Imagine the PTSD that kids will make who make their parents or loved ones sick with COVID will feel. It could ruin their lives. And let's be honest, Donald Trump is fine with that. Just as long as it's not his life that's affected, right? As long as it's not him, well, then he doesn't care, right? Doesn't care at all. And that's really at the core of who Donald Trump is.